Turn on unit. Install foot switch. Power on. Please note that probes should be installed in shutdown mode to prevent damage to the main unit and to probes. Press the power button. System Setup. Click System button. Set up hospital, doctor, ACD of IOL calculation, etc. parameters. A scan operation, contact mode. Click Patient button. Enter Patient Information Interface. Click OD or OS button to identify the eye position. OS is left eye, OD is right eye. Choose Measurement mode, Auto and Contact. Choose Patient Measurement mode, Normal, Cataract, Alpha Kick, Special. Here we choose Normal. Ask patient at a sitting condition and open eye. Make the surface anesthesia. Take the A probe. Remove the probe cap. Disinfect the probe surface with medical alcohol. Set equipment in scanning condition. Ask the patient to look directly at the probe. Put the probe gently on the vertex cornea, which will be measured. Properly adjust the gain to get a better waveform. When hearing a strange sound, it indicates the results are being measured out. The screen displays the measurement results. If not hearing strange sounds, you can adjust the probe slightly until D appears and get measurement results. The probe will be automatically frozen after measuring 10 groups of results and finish the measurement. Check the 10 groups of results. Delete unreliable data. Click the up or down arrow to the line Need Delete, and click the Delete button. The line will be deleted. Or clear the current results for remeasure. Click Clear button. The current records will be totally deleted. You can remeasure patient. Click the Print button at the bottom of the screen to print information such as data and waveforms. Immersion mode. Choose Measurement mode, Auto and Immersion. Choose Patient Measurement mode, Normal, Cataract, Alpha Kick, Special. Here we choose Normal. Connect the tube set to the immersion shell. Put the probe at the bottom of immersion shell and no need to adjust the probe, which is unique designed to save time. Recline and position the patient. Make sure patient's head is in horizontal position. Anesthetize in the surface of patient's eyes. Insert immersion shell. Using your thumb, pull back on the patient's top lid and pull the bottom lid down with the index finger. Insert shell and upper lid first. Have the patient look towards the ceiling, then insert shell under the bottom lid. Once the shell is in the patient's eye, hold the shell. Once the shell is in the patient's eye, make sure the patient's another eye is fixated on an object directly above their head. Fill the shell with normal saline until you reach the probe tip. The unit will begin measuring once normal saline reaches the probe tip, and a recognizable wave will appear on the screen. IOL calculation. Press the IOL calculation button to enter the intraocular lens calculation interface. Input parameters Key1, Key2 for the corneal curvature, AC for the anterior chamber depth, DR for postoperative retention. After selecting the applicable formula, click the Calculate button to automatically calculate the results. Print data. Click Print button. You can print data. Pachymeter function. Click P-scan to enter P mode. Click the Patient button to input patient information. Click OD or OS to identify the eye position. OD for the right eye, OS for the left eye. Select the measurement method as a single-point measurement. Ask patient at a sitting condition and open eye. Make the surface anesthesia. Disinfect a pachy probe with a medical echo. The front end of the probe is placed in the central cornea to ensure that the probe tip and the corneal surface are perpendicular. Click Start button to start the measurement. After hearing the D sound, the system completes 5 groups of measuring results. The average AVG and the standard deviation SD displays on the top of the screen. According to clinical needs, choose 5 and 9 mode to make the measurement at a peripheral location of cornea. Click the Print button at the bottom of the screen to print the picture and data information.